We have special guests joining me, two eminent cardiologists. We have Dr. Ajit Pradhan, who is Chief Cardiovascular Surgeon at the Jeevak Heart Hospital in Patna, and Dr. Pramod Kumar, the Head of Department for Cardiology at the Fortis Hospital in the National Capital. I appreciate you joining us, doctors, this morning, because, you know, our viewers have been putting out several important questions in these time of crisis. Coming to you first, Dr. Ajit Pradhan, as for Bihar, before we take our questions related to heart patients, just a few hours back, we saw how several medical aid was airlifted from Mumbai to Bihar. In that sense, the number that we're looking at currently stands at 39. How prepared is the state of Bihar in case we see a rapid surge in the numbers in the coming days?
Let me start something else first before I answer your question. The world in itself is going through a crisis. But whether we look at it as a crisis or as an opportunity to reshape our thinking depends upon us. We must use this period as a lesson how to live a life with a concern for all the humankind. That's first my message. As far as preparedness of Bihar is concerned, I guess the medical facilities here, if we reach a stage 3, will be of a grave concern. We are doing our best. Our morbidity and mortality remains low as far as compared to the other states of India. That's what I gather from the news. And but if we reach a stage where it's spread over the community and the patient needs ventilatory support, we'll be in a very, very tough spot. I hope it doesn't come to that stage.
Absolutely.
Hello.
Coming to you, Dr. Pramod Kumar, you know, this disease behaves differently with different subsets of patients, and heart patients have come out with various complaints. In that sense, your recommendations, apart from the basic preventive measures that they must adhere to, your recommendations as far as heart patients are concerned?
You correctly said that, you know, the basic preventive recommendations have to be adhered to very, very religiously, more so in this very difficult time. I would just like to point out some of the problems which they are facing, and I have been receiving a lot of telephone calls from my patients about use of antihypertensive drugs called ACE inhibitor or ARBs. Losartan, valsartan, ramipril, these are the drugs commonly used. There has been some, report that they might actually worsen the conditions because this virus acts through the same pathway through which these drugs work. But that's not true. In fact, most of the world bodies have been strongly recommended that these drugs must be continued. In fact, there is some theoretical advantage that they may actually reduce the damage to the lungs. No, it's not proven, but it may. So please continue everything that you are doing. There has been another aspect of heart disease that we have seen, that acute cases, especially the heart attacks, have suddenly come down. The admissions to the hospital because of heart attack or stroke or even some acute abdominal conditions have come down, as much as 50 to 60% all over the world. Why this has happened, we don't know. And whether we are going to see a rebound once this lockdown finishes, we have no idea. But we have to be very alert. All the hospitals, for example, Fortis Hospital, in our Shalimar Bagh, we are all geared to take care of all kind of cardiac emergencies that may happen. So everyone has to be alert, the patients, the doctors, that we may see a rebound once this lockdown comes down.
All right. In fact, our callers have also started dialing in. We have Srinivas calling us from Patiala. Srinivas, Dr. Pradhan will be taking your question. Go ahead.
Yeah. Good morning, doctor. I'm Srinivas calling from Patiala. Recently, I had a heart attack and my LAD was blocked and it was cleared through a stent. My question is, I've been going through annual medical checkup for the last 3 years, and my BP had been 120, 80, 120, and I'm a yoga practitioner. And recently I had this TMT test also, that also could not detect. The last year I had this echocardiography. Again, everything was normal. Everything was normal. I do Sirshasan also. So why this kind of a thing has happened? And in future, how can I dissolve this cholesterol issue? That is my question.
Now, you are asymptomatic now, as I gather. You've had a revascularization done, so you should take care of yourself. There are a lot of things that needs to be taken care of if you're a coronary artery disease patient. First of all, you must realize that untreated coronary artery disease patients are at the highest risk of having serious complications of COVID. Fortunate, you had your revascularization done. You should continue your medicines as prescribed. Dr. Pramod was mentioning about ACE inhibitors. If you are not taking one, you should not be taking it. What is very important, you should control your blood pressure and the statins. Statins, in some reports, have shown that it has got protective effect. Whether it's been shown to have protective effect or not is questionable. But if you are taking statins, you should never stop it during this period. Okay? You should do your exercises that you were doing earlier. You should make sure that you do not put on weight. You should have your medicines regularly. Consult doctor. If you have chest pain, if it's needed, you must. This aspect that do not go to the hospital, as avoid the hospital, is wrong. If it's needed, you must go there. If you have chest pain, but for just general checkup of getting your blood test done, if you don't have any ailments, you need not go to the hospital. Does that answer your question?
Srinivas, I hope that answers your question. We have the next caller calling in from Visakhapatnam. PL Narsimha, good morning. Good morning. Go ahead, PL Narsimha. Dr. Kumar will be taking your question. All right, I think we seem to have lost that line with PL Narsimha. We'll try and reconnect with him. Dr. Kumar, if I could ask you another question that I've come across, while speaking to heart patients. Many of them have asked questions if some of them have gone through a surgery or a heart transplant. In that sense, what kind of precautions should they be going ahead with? Because there certainly is a lot of panic among those set of patients.
Once again, I would like to reiterate that no extra precaution other than what has been recommended by our government needs to be taken. You stay at home, maintain the social distance. If you have to go out, I would certainly advise you that if you have had a transplant or you've had a bypass surgery or an angioplasty, avoid going out. But if you have to, for certain reason, make sure that you are wearing a mask and you're taking all possible precautions when you go out. Again, I would like to re-emphasize that it is preferable if you have had a heart transplant that you don't go out, because you are certainly at a higher risk than other people who have heart disease. So it's very important, continue all your medications.
All right.
If you need to consult a doctor, if you're not having any significant problem, do a tele-consultation. But if you have to go to the hospital, go. The doctors are there. Don't worry about it.
Absolutely. We have Ramesh Raina, Dr. Ramesh Raina calling in from Faridabad. Doctor, go ahead, your question please.
Question is that the general trend these days that has been observed world over is that the patients belonging to 40 years, under 40 years of age, have lesser mortality. But the people who are above 60 years with comorbidity like heart problems and diabetes do tend to get involved more. My specific question is here, that what are the first symptoms, what are the first kind of a situation that would make us believe that the patient is developing corona-related symptoms?
All right. Dr. Pramod Kumar, if you could address that concern, please.
Yes. Yes, sure. So again, see, the presentation of this COVID-19 is not different in patients or people who have underlying heart disease or diabetes or hypertension. It's not different, except that it might actually precipitate certain things like heart failure, but most of the time they will present the way others are presenting. So there is no differentiation. You have to keep your index of suspicion very high in any patients who presents with the typical symptoms. The only thing is that some of these patients who may not be having any underlying heart disease or diabetes can actually present as a cardiac patient, which is sometimes taken as a heart attack. And in fact, people have been taken to cath lab for an angiogram, and the whole hospital and the lab has got infected. So you have to be very, 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 very alert about this thing, that some of these patients, so if you have some kind of mechanism by which you can do a rapid test, or in fact the Wuhan cardiologists have advised that if you don't have a rapid test, you can actually do a chest X-ray or a HRCT to suspect whether these atypical presentations of heart disease, who might look like having a heart attack or heart failure, if they have a very typical HRCT, then the suspects has to be, you have to suspect that these people actually might be COVID-19 patients. So then you have to be very careful. If your hospital is not designated to take care of these patients must be shifted to a designated hospital. But if those tests are negative, then you can treat them in your hospital as a normal cardiac patient.
All right. Moving on to the next caller, we have Kishan calling us from Aurangabad. Kishan, your question to Dr. Yes, I hope that answers your question. I hope that answers your question, Dr. Ramesh Raina. Kishan calling in from Aurangabad. Dr. Ajit Pradhan will be taking your question. Go ahead, Kishan. All right. We seem to have lost that line with Kishan. We'll reconnect with him. But PL Narasimha was trying to get through us a short while back, is back with us. Yes. Mr. Narasimha, go ahead. Dr. Pradhan will be taking your question.
Good morning, doctors. Your people are doing a wonderful job. First point. Second thing is, I went a bypass surgery about 3 months back, and I'm under these drugs, Metexel, Ceruin, and Erova, Atrova. Should I continue with these drugs, or what should I do about it?
Absolutely. Beta blockers, if you're taking beta blockers, it should never be stopped. Atorva, as I mentioned earlier, if you're taking statins, you should never stop it during this period. So you continue all the medications that you're taking, maintain your blood pressure, blood sugar very well, and continue with all the medications that you're taking. Never stop your statins or beta blockers during this period unless, medically advised to do so. Yeah.
All right. Dr. Pramod Kumar, would you like to add to what Dr. Pradhan has said?
Yes, I think he has very clearly stated that none of the medications need to be stopped. And again, you have to see that you are in a very stable state. If there is a change in your clinical status, then you have to consult your doctor before you think of changing your medications. It's very important that you stay in touch with your doctor. If you need to go there, the doctors are there, or you can have a tele consultation and he will be able to help you. It's a different situation if you get a COVID infection. Then the doctor who is treating you will have to decide what medicines you need to continue, what medicines you need to discontinue. But till you are not infected, please do not even think of changing any of your medications.
All right, so continue with your medication, but also keep consulting your doctors. That's the suggestion.
Yeah. Yeah, can I continue? Can I add something here? Something which is sort of very important, because as a cardiac surgeon, I receive at least, and this message should go to the people at large. As a cardiac surgeon, I've given dates to my patient for cardiac surgery, and I keep receiving at least 5 or 6 calls every day. That doctor, is it can I come in for a surgery? Now, at this point, I'd like to let most people know that at this point, at this pandemic, all elective cardiac surgery should be stopped. All elective cardiac surgery should be stopped. It is dangerous to carry on elective cardiac surgery for reasons that people who were tested also to be COVID negative prior to surgery. After surgery, one of my colleagues told me that they tested positive. And if a patient who's undergone cardiac surgery tests out to be COVID positive, it's a disastrous situation and the mortality increases tenfold. So who are the patients who need cardiac surgery during this COVID is very well defined. Patients with critical coronary artery disease, which we call left main with triple V disease, with high syntax score, having rest angina, not controlled medically. Patient with aortic stenosis, critical aortic stenosis, symptomatic. Patient with left-sided valve lesion with endocarditis or thrombus, which are likely to embolize. Aortic dissections, aortic aneurysms, ascending aortic aneurysms, more than 6 centimeters. Otherwise, no elective cardiac surgery should be sought out, and people should be deferred to go to the hospital for cardiac surgery. But when one is confronted with any of these clinical situations, one should go to the hospital, get the cardiac surgery done, but the whole process of getting cardiac surgery done during this is very complex. It will take me 10 minutes to explain how to take care of the patient, their relatives, the blood donors, and the OT staff, and how to handle the OT with negative pressure, what negative pressure should there be in the OT. Everything is a very complex thing. So if you are a candidate for a serious cardiac patient who needs a COVID cardiac surgery during this period, it has to be carefully evaluated. And if doctor advises so, even in this case of pandemic, you should go in and have a surgery done.
Yes, in fact, we have various other callers also calling in. We have another doctor calling us this morning as a question for Dr. Kumar. Go ahead, Dr. Vijay. Good morning. Your question, please.
Morning, sir. I am a patient of myasthenia gravis, diabetes, hypertension, and asthma. I have got a bifascicular block. Any precaution I have to take if I get COVID-19, or should I test for it?
No. You don't need to get yourself tested unless until the ICMR has defined and it is expanded the kind of people who will require tests. If you don't fall into that group, you don't need to get yourself tested. Absolutely no need. So you can go to the ICMR guidelines. It's available on the website to see whether you fall into that category or not. If you don't fall into that category, you don't need to change. You don't need to get yourself tested. Not at all. That will be a sheer wastage. As far as your drugs are concerned, again, we will repeat and repeat that please stick to whatever your doctor has prescribed. You have a bifascicular block, you need not worry about it at all. Unless until you have symptoms, you don't need to even think about it.
All right, I hope that answers your question, doctor. We have Hari Kumar Pillai calling from Mumbai. He has a question for Dr. Pradhan. Go ahead. Hari Kumar Pillai, if you could hear us, please go ahead with your question. All right, we seem to have lost that line. But Dr. Pradhan, another question, a lot of cardiac patients do often complain of breathlessness. So how does one identify that particular symptom is happening because of, a heart-related problem or because of something that could be related to COVID-19?
Yeah, it's a very good question, actually. So if a cardiac patient is complaining of breathlessness, Dr. Pramod will actually add on to it because he's a cardiologist, is that if he's complaining of breathlessness, his echo, his clinical examination will settle the issue, whether it's cardiac or respiratory. Though at times it can become very difficult. But if we are in doubt, I think, it's better to be safe than to be sorry. You may if needed, get a COVID test done, but your first COVID test can be negative and you may be on the wrong side. Consult a cardiologist, let him do an echo, let him do an ECG, let him do a chest x-ray, let him do a clinical examination, his blood pressure. If that sorts out that if it is non-cardiac, then you got to consult a physician and rule out the problem that it could be a COVID or not. The respiratory presentation of a shortness of breath of a COVID, along with clinical symptoms, will decide actually whether it's COVID or non-COVID. Dr. Pramod, would you like to add on to that?
All right.
Yes, COVID again, has a very, it's a very difficult disease in the sense that its presentations are varied. And one of the most important presentation is shortness of breath. But if, it's an atypical presentation of COVID where other features are not present, for example, fever and other things are not there, in that case, and if this is a person who already has a cardiac problem, a chest x-ray and an HRCT is of great importance in ruling it out, because some of the biomarkers may be positive both in COVID and non-COVID patients who have heart disease. But it has been shown very clearly that the pattern of x-ray, the lung involvement in COVID and in patients who have heart disease are very, very different. And you can, most of the time, you can easily identify with a very high degree of sensitivity and specificity as far as HRCT and X-rays are concerned. So they are of great help in differentiating between shortness of breath because of COVID or because of pure cardiac conditions. So it's very important that you go to a place where the facilities are available, and if there is a confusion because COVID test is not possible or you can get a test result after 3 days, then these investigations do help you.
All right, all right. We leave it at that, Dr. Kumar and Dr. Pradhan, but appreciate you taking out time for us, speaking to us this morning and addressing all of those concerns of our viewers. Many thanks for joining us and thank you for your services. Thank you.
Can I end with something? Hello. Hello.
Yes, sure, Dr. Pradhan. Go ahead.
Hello.
Yes, sure.
I just want to end with Faiz, who's been my favorite शायर and poet. A message, दिल नाउमीद तो नहीं, नाकाम ही तो है. दिल नाउमीद तो नहीं, नाकाम ही तो है. लंबी है गम की शाम, मगर शाम ही तो है. We'll get over this. लंबी है गम की शाम, मगर शाम ही तो है. Just take care. All of you stay home. We are there out with all the other people who are trying to take care of the society. But you stay home and rest. Everything will be fine.